Hey guys, how you going? Hope you've all had a great Wednesday and a hump day to the week. Today what I wanted to talk about was rotator cuffs and rotator cuff surgery. So rotator cuffs has always been a hot topic in the physio world and the musculoskeletal world, especially when it comes to pain. And with the shoulder, we know that's a complex area. There's numerous muscles, there's ligaments, there's tendons, there's nerves, and each one of them are all pain-sensitive structures. So the question then goes, is the rotator cuff the actual cause of pain? And recent studies have kind of brought to light the question of whether rotator cuff surgery might potentially be a placebo. So a few years ago, they did a study where they compared people with shoulder pain and without shoulder pain. And the people without shoulder pain, up to 96% of those people had rotator cuff tears. They all functioned really well, no pain, no issues at all with their daily living. So you kind of go, is the rotator cuff actually the reason behind your shoulder pain? A recent study, more recent than that, in 2015, it's called the U-Cuff study in the UK, done by Oxford University, and they compared about 280 individuals who had a rotator cuff repair. Hey Mick, how you going? They compared 280 individuals who had a rotator cuff repair, and they followed them for 2 years after their surgery. And at the 2-year mark, they found that people with and without a rotator cuff had the same quality. So with people who had the rotator cuff repair, about half of them, had re-injured or re-torn their rotator cuff. However, they had people who had re-torn versus people who still had an intact surgery had the same quality of life, the same strength, and the same function. So more questions as to, is rotator cuff surgery a placebo? Really good stats, Mick. Hey Pat, how you going? Thanks for joining in. So my question today is, if you're considering surgery, really ask your surgeon, bring up these studies to them. Mention the U-Cuff study. It's probably the biggest study that's been done on shoulders following people with rotator cuff repairs, and it shows that you can still have a great quality of life even if you re-tear after surgery. So is surgery something to consider in the first place? And I would really, really question that. And we know that physiotherapy is as effective, if not better, than surgery, and comes at a fraction of the price. And when I say price, I mean financial price, the cost of living in terms of the time lost, and also the psychological effects as well of not being able to train and do your daily activities. I'm going to do a series on rotator cuffs, talking about the different issues in there, but today I really wanted to start off with surgery and question anyone considering getting surgery, especially if they haven't tried physiotherapy first, and if they are going to be getting surgery, what are the effects behind that? There's definitely more research that needs to be done. There's some really good research that's been done on the knees when it comes to meniscus repairs and the possible placebo effects of surgery with getting your meniscus repaired, but nothing's been done at the shoulder just yet. So once more research comes to fore, it'll kind of give us a better idea as to where we are with shoulder pain. But as it stands, there's a lot more to learn, and there's a lot of questions we need to ask, not only as physiotherapists, but yourself as patients or people suffering with shoulder pain, as to what is the best management for you. Hope you've had a nice little time listening to this and a bit of wisdom along the way as well. If you have any questions, pop it down below. I'm happy to get back to you with the answers. There's a quick question here just before I pop off, and it's Mick who's asked me, what are the indicators for surgery? Is it pain? Is it function? It's both. So a lot of the studies use a questionnaire which compares a range of different factors through function, your quality of life, pain, and they use that in conjunction, obviously, with the person's willingness to want to get surgery as well. But generally, most people who get surgery and who have seen an orthopedic surgeon will generally go through physiotherapy first as well. So mostly it's done well, but there are a lot of people who just go and get rotator cuff repairs without knowing about the benefits of physiotherapy and also about the possible lack of benefits of surgery or the placebo effect of surgery. Leave any questions you guys might have. Like I said, it is a very controversial topic. The research is good but not great, and there's a lot more that needs to be done as well. Hope everyone has a great night, and I'll catch you guys shortly.